pause. It's not pulling it. This is because of a rare side effect that is being investigated further. This is exactly what the FDA's role is to protect people from events like this and make sure that we know what the risk profile looks like. So what we're dealing with is, in the U.S., 7 cases of blood clots out of about 7 million doses of vaccine that have been given. So a 1 in a million side effect would not have been seen in the clinical trial, because the clinical trial was only, and I say only, 30, 40,000 people, which is a huge clinical trial. But rare side effects, we know, can't be seen in clinical trials that are of that size.
What kind of blood clots are we talking about? I saw sinus area, and then it got into medical details, and I went, we need to make a call to Dr. Vanchiere. Is this a serious side effect? Is it minor? Could it be serious? What's the deal?
So the reported ones, what CDC says, is that these are blood clots that occur around the brain and can be very serious. And so they have recommended that anyone who has gotten the J&J vaccine within a 3-week period of receiving that vaccine, it's sort of that critical period, it looks like, and they want to have folks, if you have a severe headache, shortness of breath, numbness in extremities, which could be due to a blood clot. Those are things that should prompt people to see their doctor promptly.
Doc, I'm seeing the CDC documentation that all of the cases occurred among women between the ages of 18 and 48. Any idea on why it's just isolated to women at this point?
So, we don't have all that data yet, but that's part of the investigation, because we know there are other risk factors that put women at higher risk of having blood clots in general. So, for instance, oral contraceptive use is associated with some increase in blood clotting. Smoking is associated with some increase in blood clotting. And whether those factors play a role in this particular situation, we don't know. And so now what the FDA's investigation will focus on is looking at those 7 cases and ask, okay, what's unique about those compared to people of the same age, the same race, ethnicity, et cetera, and gender that didn't get blood clots? And do we see any important information that may tell us about a risk factor other than just having received the vaccine? This may be, and it could be a genetic factor that is, otherwise insignificant, and we haven't known about before. There are a lot of hypotheses that have to be considered now.
You know that the people that are listening to you this morning that have gotten the Johnson & Johnson vaccine are probably freaking out.
No, I'm not. No, wait a second. I've had the Johnson & Johnson.
There are going to be some that are going to be freaking out. What do you say to them today, Doc?
Yeah, I understand the concern. I think it's important to remember this is a 1 in a million side effect or association at this point, and we still don't know a lot. And so as that investigation proceeds, I think the important thing is people will be calm, not panic. This is a pause of the vaccine. This is exactly what the FDA is supposed to do. And so if they have the symptoms I've described, severe headache, shortness of breath, numbness and tingling in extremity, particularly lower legs, that could be a blood clot, they need to see their doctor or urgent care for evaluation. And but there's no reason to freak out.
You mentioned, pardon me, you mentioned a second ago, 1 in a million. 1 in a million is pretty. Is 1 in a million? What's the odds? What's the number? Because 1 in a million to me sounds pretty good. What's the number at which point the CDC jumps in and says, "Hold on, let's hit the pause button"?
Yeah. So the number is going to be different depending on a lot of factors. So there are a lot of ifs and things that we don't know yet. So I'm not going to be, I can't give you a specific number to say at what point would they stop using the vaccine totally. We're nowhere near that, and no indication that would be the case.
Is this a common thing? Have you seen this before? Pardon me, I don't get vaccinated a lot. Yeah.
But
it's only 2021. It's still early. Is this a common practice?
To pause things, it is. I mean, if you think, you may not remember, but 20 years ago, we had a vaccine against rotavirus diarrhea in children, and the clinical trials looked very good, and were very good. It's a very effective vaccine for rotavirus diarrhea, but a very small number, a rare outcome, sort of in the realm of 1 in 10,000 kids, had developed an intestinal condition called intussusception, where it's a complication. And so that led to actually that vaccine being pulled from the market totally.
And pardon me again, all the critics now are going to say, see, it's too fast. We were right all along. We should never have done. What would you say to them?
No, this is not something that would have, again, been seen in the clinical trials. You would have had to study several million people in a clinical trial to see this kind of effect. If you might have one. And so again, these are rare complications, and we've been on them up front and tried to be up front all along. With long-term and rare complications, we won't know until we use the vaccine more, and that is always the case with our vaccine.
When would you expect the vaccine to be back available, and will we have to throw some doses away as a result of this?
Timeline totally unknown for potentially using the vaccine again, but expect it to be at least a few weeks, and maybe longer. And does that mean some doses will have to go to waste? It's very likely the answer is yes, but it all depends on that timeline, and nobody's going to rush that timeline. Nobody's going to short shrift the investigation until we know really what is going on.
Great stuff,
and I can't. One more. I can't say I want the J&J regardless of whatever. There's nobody that can give it now. Correct?
Correct. That's
okay.
Right. We've all been told cease and desist, and even though we know that number, 1 out of a million, there's a lot we don't know, and so what CDC's and FDA's exact statement says is out of an abundance of caution.